Good afternoon, everyone. Just after midday. So, and happy Friday. And if you're joining us from outside of Auckland, I really hope that you enjoy your freedom. And the ones that we're in Auckland, well, we can't say the same, right? But anyway, here we are and taking advantage of our time. And we're very happy, to have a really good presenter from the States about our very unique products that we sell, lasers. And I will introduce it to you, but thank you for joining us once again to DENTACHAT. And we create this forum for you guys and kind of facilitate people over the globe pretty much in creating questions and, not necessarily about a dental product. It can be, many other topics that we have covered as well. Like last week, we covered social media for dentistry, for example. But if you have any suggestions, please let us know. Right, well, today, Dr. Colucci is joining us for a presentation on lasers in dentistry, and this is a soft tissue laser. So Dr. Colucci is a clinical professor in the Department of Preventive and Restorative Dental Science of the University of California in San Francisco of School of Dentistry. He's been working with lasers since the get-go, very familiar with probably many other brands. But today we're gonna, well, I hope he's gonna talk about the ones we sell, but you're welcome to talk to any, that's fine. But we also join us with Sam Danak, which is the regional manager for DENMAT, and DENMAT is the brand of lasers that we sell. So it kind of makes sense to put it together, right? It doesn't mean that Dr. Colucci needs to talk about DENMAT specifically. He's just going to talk about lasers onto it. But before we go with Dr. Colucci in the presentation, Sam is going to give us a little bit of an introduction of the DENMAT himself and also the lasers. So Sam.
Thank you very much, Rudy.
For you guys.
Thank you for the introduction, Rudy. You can hear me?
Yes, we can hear you.
That's perfect. Thank you all for being here. I do appreciate it very much. It is so nice to reach out across the globe, all the way to New Zealand, and it's a pleasure being with you today. Just to begin, I just want to say I do work with DENMAT. I've been regional manager with DENMAT since 2015. I do cover the basically half of the world is part of my territory, and that includes New Zealand, Australia, Asia Pacific, all the Asian markets, as well as the Eastern European market and the Middle East and Africa. I do have a lot to cover, but it's always a pleasure, and I do enjoy it very much. That's why I do like to travel the world and be with the best in dentistry, and I always had the pleasure to work with everybody. Next, I just want to just tell you a little bit about DENMAT as a company. DENMAT is basically a manufacturer for a lot of brands around the world. And one of the major brands we have is basically the Lumineers products, and we do lasers and everything else. Right now, I'm located not at the DENMAT facility itself. Right now, I'm in the Central Valley of California, around 3 hours from the headquarters, and in a small city that's called Turtle Rock. It is we're known here to have a lot of agriculture and a lot of industries related to agriculture and food industry. I do live a little bit away from the headquarters, but it is in the same state of California. Next, I want to say that in general, selling laser and doing laser is something that we're really good at DENMAT, and especially a simple laser that's put together. And that's what today I wanted to just talk to you about. Not only laser in general, which is a very exciting topic. I do want to say that we, as a company, as a manufacturer since 1974, we do take pride of the lasers we put together, and we always keep in mind functionality and durability when we do such products. Um, Next, I want to talk about basically why am I excited about talking about laser, like as a topic, and why I enjoy really selling it. I want to show you in the next couple of slides. So, which is one of them, which is when I heard how beautiful the laser cuts and how uh, very precise it cuts through the cell layers, which promotes faster healing. It's not a matter of just magic. It's a matter of it doesn't cut too many cell layers into the tissue, and that's what promotes faster healing and less damage to the tissue. As you'd see, a laser versus electrosurge, the cell layers that a laser will cut is very, very minor in comparison to electrosurgical machines or a scalpel or other methods of doing surgeries. Next, I want to show you uh, just how much how many advantages the laser will have versus a scalpel. Um, just to show you just a few. Next, you will see here that the laser will coagulate blood vessels, cauterizes nerve endings, and sterilizes wound edges quickly. Like it's all at the same time happening. Coagulations will allow you, of course, to work with as a dentist with less blood, which is the key uh, sometimes to work in a much easier area while doing surgery. You see better, you have better control of blood, and by cauterizing the nerve endings, the histamine is not released, so that means less pain, post-operative pain, and that's key for the patient and for the comfort of the patient. Usually, dentists, are heroes, and it is depending on how good they treat their patients and how well of a dentistry and less pain they do, especially in the dental world. A lot of patients are scared of dentistry. It's so painful. I don't like the dentist. So it is very important for dentists to find solutions or ways to make it more comfortable for the patients. Next, I want to just talk about the actual lasers that we have. But I can go on and on about excitement. But let's look at in the next slide on our laser in particular. So we have a very, very simple laser. I keep emphasizing on the word simple because this is a lot of people are not very familiar with laser if you're starting new in the laser dentistry. And having a machine that is very complicated is always not a good advantage for you as a dentist trying to work on a new machine. So in our design, in our system that we created for the laser, we have a very simple 3-watt power continuous wave of laser, which is more than enough. Most procedures are usually worked on in a continuous wave on an average power of 1 to 1.4, 1.2. So this is more than enough power. The tips are disposable. The battery is long hours, up to 3 hours, and continuous work. And that's why what I hear from a lot of dentists is that I love the battery of your soul. It's never interrupted. We enjoy it. We never worry about it, and it's fantastic to work with and depend on. The custom button that's on the actual pad, it allows you to customize a lot of your procedures. You could do that if you have a preferable number that you like to work on in terms of power. You can customize it at any time, so it's never standard, and then you're stuck with it. You have other standards button that you can use, which is usually comes handy, like perio if you want to do periodontal treatment, it's sterile or cut. So you have 4 different sets that you can work with, but the custom is basically it's going to be one of the most used, and you can customize it the way you want. But we have others also that are already preset procedures. We have the blue aiming beam, which is a very important point about laser dentistry. especially because you work on a soft tissue that's usually pink or red. It's very important to have a contrast, which I will show you another slide later, how the contrast will show between a red and a blue aiming beam. And we were the first ones to introduce the blue aiming beam as a technology into laser dentistry. And it is very, very helpful to help you see better. Now, the wavelength that the Sol laser is at is 810. It's excellent absorption by melanin and hemoglobin, and it cuts really well, and you can depend on cutting every single time. Um, it is soft tissue only laser, and it is portable, so you can take it from one operatory to another, fully portable. It has a wireless uh, foot pedal as well, so it does communicate through Bluetooth technology. So the foot pedal will also be movable, so it's totally portable. Very ergonomic. The handpiece is done ergonomically. It has a magnetic locking system. That's very easy to just snap on the machine whenever you're not using it, and it goes right where it belongs. It has four set procedures, as I mentioned earlier, and it has a periodontal tip and a surgical tip. So the periodontal tip, it's an 8 millimeter where it allows you to reach deep pockets. It's a very, very affordable laser. And when it comes to affordability, it's extremely affordable. And you, based on your comparison, of course, of the market, you will notice that for a 2-year warranty laser made in the United States, uh, very durable. It's a very affordable laser. And that was our goal, and that's what we wanted to have. Next, we will have to cover the what comes with it. It comes with a handpiece. It comes with the of course the AC DC, the power converter. It has laser tips. It has the 3 protective glasses, not only 2. We give 3, one for the patient, one for you, and one for the assistant. The foot pedal, signs, the safety, and the instructions, as well as the 2-year warranty. Next, this is the aiming beam that's reflected on the soft tissue, blue and red, as you can see. In the blue area, sometimes, it's pretty dark, sometimes lighter, but wherever it is, it's going to show as better contrast, as you can see. And that's extremely important for your precision when you're working with the laser. Um, Next slide. Uh, as you can see, it's just the Sol will provide you everything you need in a laser, to do surgeries, to do many procedures, and as I mentioned, one of the best things is the durability of the actual battery, the simplicity to operate it, and the affordability as well. The next thing we're going to talk about is the next laser we have, which is the wireless laser. This is a portable, by like it's a very ergonomically designed one piece laser. All the It's called an NV Pro 3. It's all the mechanism is in one piece. Just it's a pen grip kind of laser. The reason why it looks like a pen, and it was designed to be this way, and with very lightweight, around 1 ounce, is just because you can control better. And if you're doing contouring, you don't have anything holding you. It's fully controllable by just like a pen. And ergonomically is fantastic to just contour or do precise procedures. And that's the beauty of the NV Pro 3. Next, it's just, as you can see, it has a few components, the foot pedal. And the reason we did the foot pedal is because we know many dentists, they love to control using the foot pedal. They're used to it. And dentistry, the dentists use it for high-speed motors. It's very convenient for them, and they kind of try to control the power this way, which is unlike some other lasers that have a grip. Usually they control it by hand. Ours is controlled by a foot pedal, which is great addition to it, and in great control for also for the dentist, which is always in mind. It has a charger base. It has a place to put one battery to charge and another battery. And then you can always add another battery if you want a third one. If you want to purchase an extra one, it comes with two. But if you do prefer to have an extra one, you can always add an extra one, and there is another hole ready for it to be installed. So you can actually charge 3 batteries at the same time. Next. We have the lithium battery, as you can see. The lithium battery we have, it doesn't burn or it doesn't stop if you charge it as many times as you want. It has a stopping system where when it's undercharged or overcharged cycles, it doesn't matter. It is just like an iPhone. It doesn't burn or it doesn't overheat or anything like that while you're charging it. And then we have also disposable tips that come with 2 sizes, one for perio, one for surgical. Next. This is the kit component that comes with the unit. It's got also 3 safety glasses, 2 batteries, as I mentioned earlier, the power supply, the foot pedal, the AA batteries, that's for the foot pedal, and the disposable tips. It comes with 5 each, 7mm and 5mm. And does have also the warning sign, the manual, and the carbon film to initiate. Next. This is a quick comparison between the Soul and the NV Pro 3. Basically, they're both good. The power of the NV Pro 3 is 2 watt on average. As I mentioned earlier, you will not need more than 1.2. In most cases, very powerful. And then the Soul has more power, which is 3 watts. That doesn't mean that you will need the 3 watt, but it is designed with a 3 watt on continuous, and on pulse it's 5 watts. The difference is basically the battery power. The Soul has a 3-hour battery, while the NV Pro 3 works on a 20 minutes cycle. But what I recommend, if you are a periodontist who's going to be treating multiple pockets at one session, and then you are going to use the laser constantly for a period of time, I recommend the Soul. But the NV Pro 3 is definitely also, because it has the extra battery, it will work for you. But I do recommend between the two. If you are a periodontist, the Soul might work a little better for you. But both lasers are excellent, and I look at the NV Pro 3 as the newer iPhone versus the last version of the iPhone, which is the Soul. Thank you. I will hand it over to Dr. Kalusi. I appreciate you being here, and then until the next time. If you have questions later, we'll be able to answer them. Thank you.
Thank you so much, Sam. That was pretty cool. They're both, you can get either laser, from Allura, of course. But if you have any other questions, you can either put it on the chat, or you can contact us as well. We do, along with the CPD points in the end of the presentation, we have a small bundle, and a little bit of a deal for the lasers. So please stay tuned. So no more introduction. Dr. Kalusi joining us from San Francisco. Good evening for you, and good afternoon for us.
Okay. Put the first slide on when you get a chance, and we'll go from there. Yeah, next. Yeah, thank you. I'm really happy to be here. My wife and I spent a marvelous 3 weeks on the South Island of New Zealand in the end of January, the beginning of February in 2020, the last time we could actually travel, and had just a great time. New Zealand is a place we want to return. Anyway, this is me. I graduated in 1970, so I've been a dentist for 51 years. I practiced for 35 years in private practice. I switched over to being part of the faculty at the University of California, San Francisco. And I've been using lasers of all kinds since 1991. Next slide, please. Yep, I'm in south of San Francisco. There's the big city. Down at the bottom is the town of Portola Valley. It's right on the San Andreas earthquake fault. That's where I live, about 40 miles south of San Francisco. Beautiful little country town. But I'm still a city person. So go ahead. So today, let me show you for about a half an hour of a number of clinical applications of the laser. I have a few fundamental slides, but if you look at, go ahead. If you look at the next slide is the patient presented with a rather gummy smile. You can forward that next, there you go. And if you go to the next slide, here is about 13 days later where we'll revise the smile simply with the diode SOL laser. We'll talk more about that, but it's something you can do if you choose to help your patient improve their smile. On the next slide, you may see something you'll see more often in clinical general dental practice. Here's some inflammatory tissue around what appears to be an old crown. Patient is uncomfortable, it's bleeding. What can we do? Next slide shows the finished product about 2 weeks later. We contoured the tissue, removed the disease, and placed a new crown. Something you can easily do with the SOL or the NB laser. The next slide shows one of my favorite applications, some periodontal inflammation around one tooth. There's something wrong with this tissue relative to the other tissue, and I maintain that we need to be more careful of disinfection. So with the next slide, you'll see the laser in place up in the pocket, and the next slide shows a result. 6 months later, the tissue has healed and returned to normalcy. How does that happen? I maintain that the laser helped it to happen. Adjunctively, using a laser for your periodontal treatment will be some of the best treatment you can render. We'll talk more about that. Okay, let me show you some fundamentals. Early in the 19th century, people like Einstein, etc., started to study light, and they realized that light had two components. Next slide shows one of them. Light exists as a wave propagating through space. And if you click one more time, you'll see the wave on there. There we go. So light exists as a wave. We understand that. But the next slide is very interesting, and that is that light can also exist as a thing. We call it a photon. It's a particle, an elemental unit of energy. So what we're trying to tell you is the dental laser produces a wave of these particles of light called photons. As Mr. Danik mentioned, we can have either continuous or pulsed laser emission. Okay. There's three basic kinds of lasers, just to get clear. The one we're talking about today is a semiconductor. That's a diode. There is a different laser based on a solid state crystal. Usually the crystals are with a G called garnet. And the third kind of laser is a gas laser. But again, today, and my favorite laser of all, is a diode semiconductor laser. Okay, next slide. You've already seen this picture. This is the SOL laser. And it has its energy delivered on this very thin fiber. You'll see this is how we use it clinically. We put a plastic barrier over the laser control panel and a plastic barrier around the handpiece. Again, the tip is disposable, and you can just barely see the wonderful blue aiming beam out the end there. And this is how the diode laser, called in this case the SOL laser, delivers its energy to your patient in a fiber optic cable with a disposable tip. Okay, next. And you'll see the text there. Go ahead and keep past that. Yeah. And here's the close-up of this handpiece. It's very easy to use. You can grip it real well. And this is my favorite one to use with my students. Again, the NB laser really ups the bar on this. You need to get more control. But this is a laser and handpiece I like a lot. Okay. Specifically, the diode laser, the SOL or the NB, it primarily loves to see tissue, pigment, and blood. It'll have no interaction with a healthy tooth, enamel, cementum, or dentin, and no interaction with water. So we can contour tissue touching the tooth. We can work in a wet environment. And if we have inflammatory disease, the laser is very, very good at reducing that. Okay. And here's a nice example of pigmented tissue. The SOL laser would love to see this. Okay. Next. Oh, here's a laser being attracted to the figure. Okay, and next. And here's a finished result. Great. We can get some coagulation. Here's some bleeding area. Turn on the laser. Next slide. And next slide. And you'll see we get really good coagulation. So the laser can be used very helpfully in surgery. Okay. And next. Here we can go ahead next. Here we can touch the tooth surface with the laser and not have any harm. Next. Our finished result. Nice looking tissue, no harm to the tooth, good contour. Okay, next please. Go ahead and put the one more picture on. Most of the procedures are done with this tip in contact with the tissue. You can see the top tissue and the laser is touching that, starting to revise that frenum. On the bottom, for coagulation, you can use the tip in a non-contact mode. There'll be more about this in training when you buy the laser. So I want to give you an example of how things work. Okay, next slide. Pardon me. One thing to remember is the laser produces heat in the tissue, but it does that by using light. It's not like an electrosurge where the tip is hot and burns the tissue. I want to speak about tissue temperature just for a moment. So next slide, please. And go ahead and keep going. Good. At 50 degrees centigrade, we can actually offer disinfection on the tissue. At 60 degrees, we can coagulate the tissue and remove denatured protein. At 100 degrees, we can remove and vaporize the tissue. Now, those numbers may not mean too much, but what I want to show you is there's 3 different procedures you can do on soft tissue with your diode laser. Next slide, please. At 50 degrees, you can disinfect a lesion. Now you may ask, how can I get 50 degrees? And the answer is you adjust the power. Remember that control panel, there's some settings on there you can set for a disinfection setting. So 50 degrees, you can disinfect. Next slide. 60 degrees, you can remove granulation tissue. Next slide. You can also coagulate at 60 degrees. And next slide. At 100 degrees, you can perform surgery, excision, and incisions. All I'm trying to tell you is a laser can precisely deliver the procedure you want, much different than any other instrument. And it's simply a matter of adjusting the power, and the diode lasers are easy to adjust. Okay, perfect. Next slide. Let's look at some dentistry. Sit back and relax. Let me show you a number of clinical cases here. Okay, first, let's talk about contouring soft tissue, removing extra gingiva to have a better smile. Next, look at your proposed outline, see what you want to do. Next, pick up the laser, adjust the power to what you want to proceed at 100 degrees centigrade, and contour the gingiva. Again, you can touch the tooth with this contact tip. The diode will not interact with the tooth. Okay, next slide. You can bevel, you can contour. I hope you can see there's absolutely no bleeding. This is the clinical picture of what you see when you do it. Okay, and next slide. Here we are finished. I showed you this before, but this is a pretty good smile outline. And I can tell you that the tissue should stay right there. Very predictable healing, minimal tissue damage. If you look around, you'll see no area that's blotchy or burned, and it gets a very, very good result. Okay, next slide. Quickly, this is a patient who thought the smile was too gummy all the way around. Now, clearly, we have some periodontal considerations. Can we remove enough tissue? We measure for biologic width, all the things that we have to do despite your instrumentation. That discussion is for another day, but let's go to the next slide. You can see the laser starting to work just as I showed you. You go to the next slide, here's the finished result. And the next slide shows you about 2 weeks later, the patient really loved the final result. I was happy because the tissue stayed where I wanted it, giving the patient a great smile. Okay, next slide. Another example, rather little trickier because the patient has some fibrous tissue, but again, using the laser. Next slide. Here's our tissue contouring, and the next slide shows the healed smile. This is about 2 weeks later. Works out really well. Oh, the question is any pain, and the answer is I anesthetize the tissue. As we indicated, the patient response is usually very, very mild discomfort, much different than if you use a scalpel or electrosurgery. Okay, next slide. Pardon me. Next slide shows a more complicated case. The patient wanted some change of his smile. I wanted to do some orthodontics. The patient said he wasn't interested. So I said, all right, I will do some maximally invasive dentistry, and go ahead and do the slides. I prepared these teeth for veneers. I'm measuring for biologic width to see if I can contour the tissue, and I can. Please continue with the slides. You'll see I'm laying out the smile design I'd like for the tissue. Go ahead and click through and click again. And you see here's our finished gingival contouring. I'm going to finish up the preparations. Again, you can see the bleeding is well under control. I use the laser also to trough around the preparations so that I can take my impression. Next slide. Here's the patient returned in 1 week. You can see the tissue is healing very, very well. Next slide. I seated all the veneers at that same 1 week appointment. Next slide. Here is the smile in 2 weeks' time. And the next slide shows it in 6 months' time. And the answer is yes, the same day impression. If you're comfortable in contouring the tissue, you can take your impression the same day. Great. Okay, next slide. Here's some challenges. You can see a carious lesion with the gingiva starting to grow into it. Not an uncommon situation, especially when there's a carious lesion that's long-standing. What should we do? Should we pick up a scalpel and cut that off? Should we try and pack some cord in there? My answer is no. Use the laser, remove the extra tissue. Go ahead and go to the next slide. Get it out of the way. You can see the tissue is not bleeding. We can finish our preparation. And next slide. We can place our, in this case, a build-up restoration. But you can see I've managed the gingival tissue. I've removed the excess, and it's a very good procedure to do. Very difficult to do without a laser, but with a laser, it makes it easy. Next slide. Another situation where we're trying to restore this tooth. You can see toward the mesial, the tissue is inflamed. There's certainly some redundant tissue there. Next slide. Let's remove it with the diode laser. And next slide. There's our finished restoration. You can see we've got a very dry field. We can go ahead and place our composite or whatever you want to do and not be worried about any moisture contamination. Okay, next slide. This is actually from our clinic. I have a number of my students' slides in here as well, but on the upper right central incisor, which you may call 1-1, I call it number 8, but we don't have to worry about that right now. Just at the gingival aspect, there's a small discoloration. The patient was concerned. The patient was also concerned about the gingival overgrowth. Patient said, can you do anything? And we said, of course we can. Next slide, please. Using the diode laser, we contoured the tissue, and it's very important to do the contouring, which we can discuss in another course. but you have to bevel and do a gingivoplasty there. Once you do, the tissue is now permanently out of the way. There's the carious lesion. You can go ahead and conventionally remove that. Next slide. Here's our finished. Here we are finished for the day. The tissue is not bleeding. It's not bleeding. It's very comfortable. We ask the patient to carefully avoid brushing this area for about a day. We also apply some vitamin E oil directly on the tissue, which is good for burned tissue. And we'll go to the next slide. This is the result 10 days later. The patient was thrilled. The tissue contour is very, very acceptable. I can see that on the close-up, I could probably do a little bit on the left central, but what I'm trying to tell you is the tissue stays where you put it as long as you treat it properly with the proper amount of power. Okay, next slide. A similar situation here, some overgrown gingival tissue. Patient wondered if we could recontour the smile. Again, measuring biologic width. We had enough tissue, so next slide. Here's the immediate postoperative result. Contouring the tissue, doing a lot of beveling, etc., interproximally there because we need to restore the physiologic contour of the tissue. Next slide, please. This is 10 days later. Tissue's healing just fine. I expect a good result. You can see how we thinned out the tissue and made it look much more like the adjacent healthy tissue. Okay, so that's soft tissue crown lengthening. Let's talk a bit for a moment about removing some pigmentation. Next slide. Here's a patient presenting with quite a bit of pigmentation. Go ahead, next slide. I've got a better open arch there. The diode laser is very, very good for removing this. Again, using anesthetic because the patient will feel some pain if you don't. But using anesthetic, go to the next slide. Use your diode laser to contour, remove the overlying pigmented tissue. As you go, you'll offer some coagulation. You can clean and bevel as you go. And next slide. Here's the immediate postoperative result. We have good hemostasis. Again, this patient, we tell the patient to be very, very careful. Don't overstimulate the area. Vitamin E oil for a couple of days works very well on maintaining any inflammatory response. Next slide, please. Here we are, healed. This was 3 weeks later. And next slide is 6 months later. Now, this will work fabulously unless the patient is a smoker. If the patient's smoking, the literature tells us that the melanocytes will proliferate once more. But if the patient is not smoking or perhaps need a motivation for not smoking, this procedure seems to work very, very well. So again, if you see pigmentation, amalgam tattoos, things like that, you can do this procedure with your diode laser. Next slide. One of my favorite subjects to talk about is how can we manage impressions for indirect restorations, whether they be laboratory fabricated or computer machine milled. The challenge is getting a good impression. Remember that 60-degree setting I was talking about. So let's set the laser down a bit to 60 degrees. Let's not cut healthy tissue. Let's simply debride, degranulate, and offer coagulation. Next slide. In about a minute, we've uncovered all the margins. Again, we haven't affected the margins at all because the laser will not interact with healthy tooth structure. Next slide shows a very nice impression, perhaps different than you're used to seeing because there's no deep, wide sulcus, just a small area capturing beautifully your preparation. And the next slide shows the finished crowns. Again, the tissue looks fine. We didn't get any recession. We didn't damage any tissue. We have what we expect, which is very, very good dentistry. Okay, next slide. I showed this at the beginning. Here's a very awful, angry looking tissue. Next slide, we took the crown off and we uncovered a very, kind of like a going treasure hunting. This is an old screw-in post. Again, I started my career in 1970. We used to use these all the time. You younger practitioners probably won't realize this. We used to screw the post into the root. God help us. I'm not sure how it worked, but look how angry that tissue is. Clearly, we can't take an impression. Clearly, we shouldn't. There's a lot of granulation tissue, inflammatory tissue that it should be removed. Well, Next slide shows after we finished, let it put a temporary on there. There's our finished tissue. Next slide shows the impression. Looks great. And the next slide shows the finished crown. A wonderful result. I can't get this kind of result without using my laser to debride and control the tissue. Okay, next slide. Let's look at some oral surgery procedures. Oral surgery is maybe a loaded term, but yes, Shalini, hold on, and I'm going to show you some implant head impressions. Coming. Thank you for the question. Okay, next slide. How about revising this freedom? You can see the periodontal tissue is being pulled. Why don't we do something about that? Pick up a scalpel? Sure. Pick up a laser? Much better. Okay, next slide. Here's the laser revising those fibers. You can see the hemostasis is perfectly under control. We dissect until we're finished. Next slide. There's how we have our permanent dissection. We're all happy with it. There's no further tissue pull. We'll put some vitamin E on this, no sutures, and send the patient home. Next slide, please. Remind the patient that in about 3 days, the tissue will start to form a fibrin clot. It'll turn white. I didn't know that in my first procedure. I thought there was infection, but no, this is normal intraoral healing of secondary intention. Next slide, please. Here's the tissue healed in about a week. And next slide shows the healing in 2 weeks. Happy with the result. You can see the freedom is no longer pulling. The patient was very comfortable. Next slide, please, shows a more interesting case. Interesting in the fact that patient had a problem. This was a 12-year-old girl. She'd been having speech therapy for 5 years and still talked with a very disabling speech. Next slide. You can see the extent of her, or the non-extent of her tongue. Wonder what the problem is? The next slide shows it to you. She has 3 frenal attachments. Apparently the speech pathologist didn't bother to look inside of her mouth. So what should we do? Why don't we relieve these and give this patient the freedom to move her tongue? This can be a little scary, but the next slide shows the immediate post-operative result. You dissect the frenum away from the attachment, and you get a conventional V-shaped cut. No bleeding, very comfortable. Again, we use vitamin E oil. Next slide shows the immediate difference in the patient extending her tongue. Next slide shows the healed tissue in 2 weeks. And the good news is that the final slide shows the patient being able to extend her tongue fully, and she's talking normally. Go ahead, next slide. Great result. Patient's first comment to me was she was so happy because she could lick an ice cream cone, which tugs at my heart because I test positive for liking ice cream. Anyway, another great result, another great use for the laser. Okay, next slide. We see it. Uncovering implants. The diode laser energy from the SOL does not interact with the metal. Go ahead, next slide. So let's find our implant. Next slide. Let's contour the tissue. Yes, the incisions are a little bit ragged. You can clean these up, and you can clean them up and contour. I wanted to remove some extra tissue here, so here's the product. And next slide shows one of the healing areas. This is actually on the other side of the mouth, but here it is all healed. Again, no interaction with the metal of the implant. Next slide. Similar case. Okay, next. Uncovering. Next, place on your healing abutment. Next slide. Tissue is all healed. Last slide. Restoration is placed. Tissue looks great, works well. Next slide, another different view, very similar, laser being used. Next slide. Again, touching the implant is fine. Go ahead, next slide. All set, uncover. Next slide, put on your abutments. And last slide, get healing. Again, the laser is a very, very good tool for uncovering your osseointegrated fixtures. No danger to the implant. One of the best tools you can use. Again, controlling the bleeding, getting good tissue contour. Okay, next procedure we can do, go ahead and next slide, is recontouring the tissue when you're placing a fixed bridge. So here's an old fixed bridge with replacing the upper left lateral incisor. Next. Tissue underneath it looks awful. Let's probe to the bone, make sure we can remove some tissue, and the answer is of course we can. We've got about 4 millimeters of tissue to the bone. Let's make an ovate receptacle for our ponic. Next slide. Here it is. Contour the tissue. Make sure you're giving a good emergence profile and a nice contour on the buccal, and remove the rest of this tissue. Next slide. Shows our finished prosthesis. It looks a lot better, looks a lot more natural, and the patient can clean because it's a convex ponic and the tissue adapts to it very, very well. Okay, one good example, another of lasers. How about exposure unerupted teeth? Okay, go ahead. There's a tooth. Let's find it. Pick up your laser. Go. Start to remove the soft tissue over the top of the tooth. Keep going. There we are. Our teeth are exposed. Last slide. It's magic. Nature can take care of the rest. You'll have a very happy patient. Teeth can erupt normally. You can see how they're going to erupt if you need to do some orthodontics. But again, no interaction with healthy tooth structure. Go ahead and use your diode laser. 10 days later, the teeth are appearing wonderfully. Okay, next slide. How about working on edentulous areas? Next slide. Again, a frenal attachment, way too high on the ridge to deal with. Pick up your SOL laser or your MV laser. Next slide. Go ahead and contour. By the way, this is a little different tip than you're used to seeing. The tips now are white, but they used to be orange long ago. Anyway, next slide. Here's the finished frenectomy. And next slide. About 2 weeks later, we've deepened the vestibule. The frenum is attached much lower on the ridge. We have all of this nice healthy ridge to make our new denture. Another good use for the laser. Next slide. And next. Again, the tooth is erupted almost. There's some inflammatory tissue holding us up. What should we do? I know. Let's use our laser. Next slide. Contour, remove that tissue. It's granulation tissue. It's hyperplastic tissue. The patient doesn't need it. The tooth can erupt further. Now, periodontally, this still has a periodontal pocket, which we'll have to evaluate. I'm not sure we want to keep this tooth. We may want to remove it. Looks like there's a small lesion starting for caries, so we have to deal with that. But here's immediate postoperative result. Next slide. 1 week later, the tissue is much healthier. The patient's more comfortable. We can now figure out what we want to do. Either keep this tooth or extract it. But the laser can help you do that. Okay, next slide. And next. How about fibrous tissue, maybe as a result of orthodontics? Okay, no problem. Next slide. Contour it. Remove all the tissue. You have good hemostasis. Next slide. Shows tissue starting to heal more normal. Again, if you want to touch this up, depending on what's going on, you can certainly do that. Patient is just finishing orthodontics. We need to put some fluoride on these teeth to remineralize them. But we have a good start on at least getting healthier gingiva. Next slide. Irritation fibroma. If you can establish a clinical diagnosis for that, which is easy to do, you can use your laser to excise that. If you choose to send it out for pathology, the oral pathologist will be informed the laser was used. As a matter of fact, lasers are used more and more for excising lesions, both benign and cancerous. Next slide. Shows our finished product. Good coagulation. You can see in the middle here, there's a little capillary, not bleeding anymore. Remove the tissue with a healthy boundary, just as you normally would for a biopsy. And next slide shows the tissue healed in 2 weeks. Looks great. We don't see much scarring in laser procedures, and the patient is very comfortable. Okay, next slide. And next, vascular lesions. You know what I'm going to say. The laser loves to see blood, so pick up your laser and go ahead and poke it. Next slide. There you go. Remove all the blood. Do a little tissue contouring. Next slide. Lesion is fully healed. Good way to do it. Good way to do it. Next slide. Mucus retention phenomenon, or a cyst, or mucocele, depending what your language is. Go ahead and here it is, much like a fibroma, but it's got pockets of mucose containing sacs in there. So next, make your little incision. Next, go ahead and start dissecting. You can see removing these various things. Look how the bleeding is under control. You can pick up your laser and remove these little stalks of tissue. Next, probe around, see if anything is done. Next slide shows I'm applying some vitamin E oil out of a vitamin E capsule. Again, I'm not going to put any sutures. The vitamin E works very, very well. Have the patient apply this as well. So usually 2 days worth of some treatment of vitamin E really, really helps to be comfortable. Next slide shows all the different areas of mucus retention we removed. Next slide shows our suture we put in there. And next slide shows the about 5 days later, we took the sutures out. And the next slide shows 2 weeks of healing. I didn't have a chance to do any further follow-up, but the patient reacted and healed very comfortably. Okay, next slides. Again, one of my favorite subjects, adjunctive, important word, use of the laser for treating periodontal and peri-implant disease. So here's our pocket. Next slide. Using a perio-tip on the laser, and again, using only about a 60-degree setting. Here we are, we're degranulating. Go ahead. And we got some resolution. This was 3 months later. Gained about 2 millimeters of attachment. Okay, next. Similar situation. Go. Sorry, that last slide, go back to the last slide for a second. This is the healed result in 6 months. So you see the tissue is still healed and much healthier. Okay, sorry. Next slide. Similar pocket. Go ahead. Laser in place to the depth of the pocket. Next slide. Immediate postoperative. You can see the tissue is under control. This is after scaling. I should emphasize, we remove the calculus first and then use the laser second. Go ahead. Next slide. This was 3 months later. The tissue pocket is resolved a bit. We've got a couple of millimeters of attachment. We find that all the time. Okay, next slide. This is peri-implant mucositis. Again, similar to periodontitis because it's an inflammatory disease caused by biofilm. Remove any calculus and biofilm that you can. Use the laser adjunctively at a 60-degree setting. Go ahead. Put the laser in there. Again, no interaction with the implant. This is safe to do. And next slide shows our 6-month healing. The next slide shows a radiograph showing that we still have good osseointegration. If you go to the next slide. No damage, no problem. Okay, next slide. Again, a close-up of the laser working around. So, implant disease, periodontal disease, adjunctive use. Again, I showed this at the outset. Here's one pocket that has a problem. Let's use the laser, 60 degrees in the pocket, removing granulation tissue. Next slide. Here's a piece of that granulation tissue coming out. Very interesting. We got good healing. Okay, next slide. Similar situation. Next slide. We fixed it. Aphthous ulcers, herpetic lesions. Next slide. There's one. Use your laser at 50 degrees centigrade, non-contact. About 2 minutes of laser time. There's some air you can blow over there. No anesthesia. Just have the patient tell you if the area is getting too uncomfortable. But low power, going back and forth. Next slide. You'll probably see a slight color change in the tissue, but the patient will report that there's less discomfort. Okay, next slide. Aphthous ulcer, same thing. Next slide. 50 degrees centigrade with your laser. Next slide. 3 days later, lesion is healed, patient is more comfortable. And lastly, next slide. One more. I mentioned this before, coagulation, 60 degrees centigrade. Next slide. Use your laser. And next slide. Good coagulation. If your patient is on a blood thinner, please consult with the physician. But most of the physicians up at the university are very happy. We can use a laser for minor, emphasis on the word minor, oral surgery. Okay? Just a few slides. Why buy a laser? Again, I don't work for DenMat. I'm getting an honorarium for this. I'm one of you. I'm a clinician. I'm a dentist. I buy what I can use, and I can tell you a laser is a great value. But next slide. Why buy a diode laser? Why buy an SOL laser? Well, first of all, SOL and ND are from an excellent company. I can vouch for them, but why buy a laser? Look at all the things we've done. Tissue retraction for crown and bridge, for implants, for restorative dentistry, getting rid of the tissue so you can see the carious lesion. Minor oral surgery, initial phase 1 periodontal therapy, management of ulcers. Next slide. I think the best reason for buying a laser is to help you perform your procedures better. The laser is easy to use, it's affordable, and I think it'd be a very valuable instrument for all your soft tissue. And last slide. You'll have happy patients. Guess what? The pediatric patient came in first, and guess who followed? The mom. The pediatric patient needed a small area of tooth uncovering for eruption. The mom was carefully watching. She and her whole family then joined us. The magic of laser dentistry. Anyway, thank you very much. I enjoyed presenting this to you.
Thank you very much, Donald. Thank you so much for that. It was very interesting. I found a few of the pictures a bit, but that's why I'm not dentist, right? Anyway, so yeah, well, thank you for answering the questions there. I just have Mark here with me, and he has a few questions on. So I'll just ask you again to unmute. Oh, let me just find you first. Mark, what's your question?
Donald, thank you very much for that. Could you just talk about initiated versus non-initiated tips?
Yes, initiation is a process of putting a little bit of pigment on the tip of the laser so it can kind of jumpstart it. The easiest way to do that is to take a piece of articulating paper and just touch the laser to it. Pardon me. If the area was very bloody, like one of the, I don't know, the extraction, no, not sorry, one of the areas of inflammation I think I was trying to show you, the blood will actually initiate the laser as well. But because the laser has very low peak power, it sometimes needs a boost to start cutting. Once you start cutting, the tissue inflammation will take care of it. So my point is, before I start, I pick up a piece of articulating paper and touch the laser to it for about 2 seconds, putting a little bit of pigment on the end of the fiber, and then go ahead and do your excisions. For coagulation and for disinfection, do not initiate. We want the laser energy to flow out of the tip, and since we're using the tip in a non-contact mode, no initiation is necessary. Does that answer the question?
Yeah, that's
Okay.
great. Actually, somebody's come through on chat, Donald, and wanting to know about the use of lasers in endo.
Excellent. Yes. Pretend the endo canal is a periodontal pocket, and you can use a laser at a 60-degree temperature, putting it in the, use a moist canal. I prefer to clean out, if you use sodium hypochlorite, take the hypochlorite out and either put water, or if you have some leftover anesthetic in your syringe, just moisten the canal and use a laser up and the tip up and down there for about roughly 30 seconds per canal, depending on the average length. You'll get some added disinfection with the laser energy.
Great, thanks.
Great question. Thanks.
Just one further question. Is there much research being done in terms of laser use for biostimulation?
Absolutely. I'm smiling because it's it's a field here in the U.S. that's just taking off. Although my European colleagues, and I think my colleagues in Asia, where I lecture a lot, and perhaps in New Zealand, they're all ahead of us on that. Biostimulation is the use of a laser in a non-thermal way. In other words, we're not heating up the tissue, we're not cutting it, we're not coagulating it, we're not really disinfecting it. It's the presence of light penetrating into the tissue with minimum to no temperature change. But just like right now, I'm sitting at my computer, and you can see the this side of my face, which is my right side, has got some light on it. Maybe I look better with light on, but light is a magic potion for all of us to feel better. And it turns out that light sources, if they were to shine into tissue, helps both healing and removal of inflammation. So lasers can be used to make that light energy progress into the tissue. One thing I didn't say is the diode laser, because it has no interaction with water, will actually penetrate quite a ways into tissue at a very low power. If you turn the power up to 100 degrees, you will cut the tissue. We're not talking about that. But biostimulation is a very useful tool. At the moment, I've actually spoken to DENMAT and other manufacturers to try and get us a wider dispersing tip, almost like a curing light, because we need very low energy at a very higher, shall I say, a larger spot size, larger diameter. So stay tuned for perhaps an attachment to your SOL laser you can use for biostimulation. But my colleagues and I use a different biostimulatory laser to help with our TMJ patients, also with some of our patients with radiation mucositis. So yeah, stay tuned for more biostimulation.
Excellent, thank you.
Well, thank you again, Donald, and thank you, Sam, who joined us for DENMAT. So we're doing a deal of $500 off and a box of tips if you buy it before next Friday, which is the 24th. So if you would like to get in touch, please contact equipment@luro.co.nz or any of your reps, and we can sort that out for you. So $500 off and a box of tip. Also next week, DENTACHAT, we have Professor Laurie Walsh from the University of Queensland in Brisbane, and he's coming to talk about the cornea ozone taps and how they work in your practice, and about microbials and stuff like that. Anyway,
say hi to Larry Walsh for me. I know him. He's a wonderful colleague. So
I will. He's a laugh. I will. Right. Cool. Thank you so much, guys. Happy Friday, and I will see you guys next week. Yeah. Thank you so much, Professor and Sam. See you guys.
Thank you.
Bye bye.
Bye bye.